Cardiovascular disease is the leading cause of death in New Zealand, and there are often very few warning signs before people have a heart attack or a stroke. But unlike many other long-term conditions, we can predict who is most likely to develop cardiovascular disease or diabetes, and we can work with them to lower that risk. This is particularly important for those who might not have any signs or symptoms, but who are at risk of developing diabetes or cardiovascular disease in the future. There are a number of factors which impact on a person's risk of suffering some type of cardiovascular event. These include age, gender, ethnicity, personal and family history, smoking status, blood pressure, pulse, waist circumference, body mass index, cholesterol and blood glucose levels. The good news is that you're likely to already have a lot of useful patient information you can use for their cardiovascular disease risk assessments. The more information that you have, the better, because some of these individual risk factors can increase a patient's cardiovascular risk by as much as 5%. The essential indicators are blood pressure, blood lipid levels, blood glucose levels, and smoking status. You can use blood pressure, serum cholesterol, and blood glucose results that have been recorded in the last 5 years if your patient's circumstances haven't changed significantly. If you need an up-to-date blood pressure measurement and the first one is elevated, for instance above 160 on 95, take another and record the average of the two. When you ask a patient to get a blood test, request a non-fasting lipid profile. If their cholesterol is elevated above 8 millimoles per litre, they'll need to repeat the test. And this can be fasting or non-fasting. Many GPs and nurses say that getting patients to have a blood test is one of the most challenging aspects of getting a cardiovascular risk assessment completed. It's worthwhile to think about opportunistic blood testing and offering free heart and diabetes checks to patients. Once you have all the information to complete the cardiovascular risk assessment, you can use either the New Zealand adapted Framingham cardiovascular risk charts that are in the primary care handbook, or you can use a validated electronic cardiovascular risk assessment tool. If you find a patient does have a higher chance of cardiovascular disease or diabetes, you can then take the necessary steps to help them improve their health. This is where shared decision making comes in. The Ministry advocates a patient-centred approach to ensure patients make informed decisions about their treatment plans and have ownership of their own health. Depending on a person's risk level, a treatment plan might include medication or lifestyle changes such as improved diet or increased physical activity. When it comes to developing a treatment plan, I try to encourage people to make a single change at a time and opt for changes which will have the greatest impact, such as quitting smoking. Although people with existing cardiovascular disease don't need to have their risk calculated, it's still good practice to record their cardiovascular disease risk, which is 35%, in your patient management system. Also include recent blood pressure, blood lipid and blood glucose levels. This way, the information is accessible if you or your nursing team run heart health clinics, if you ever need to use GP to GP to transfer patient files, or when you're deciding treatment options with a patient.